Welcome to Health Vision, WOUB's program on medicine and health. I'm your host, Jackie Wolfe, Associate Professor of Social Medicine at Ohio University. My guests today are both from Planned Parenthood of Southeast Ohio. Lisa Wolfe is the Director of Health Services, and Kate Huebner is Community Education Coordinator, and we're going to talk about the services offered by Planned Parenthood. It's so nice to have both of you here today.
Thank you so much.
Thank you for having us.
Lisa, why don't you tell me a little bit about, just in a very general sense, what is Planned Parenthood and what kind of general services do you offer to the community?
Okay. Planned Parenthood as an organization has been around for, believe over 75 years across the country. There are approximately 120 affiliates. There's Planned Parenthood Federation of America, and then there's affiliates. Planned Parenthood of Southeast Ohio is one of the affiliates. We are currently offering services at 3 different sites. We are at the Jackson Health Department twice a month. We're in Chillicothe, and we have the Athens Health Center here. The services we offer: basic reproductive health care, annual exams, sexually transmitted infection testing, birth control, almost the full array of birth control we can offer, HIV testing, pregnancy testing, emergency contraception, pretty much anything you need. And we do serve women and men.
And we should emphasize again that this is a nationwide organization. There are Planned Parenthoods in communities around the country, rural areas, urban areas,
Yes.
large cities, small towns. And you were telling me a little bit earlier, we were talking a little bit before the show, that in Athens, Ohio, this is one of the very smallest centers.
It is.
And I think you said the second smallest Planned Parenthood
Yep.
affiliate in the country.
Yes.
So we're very lucky in our tiny area to have these kind of services available to us.
We're excited to be here.
I'd like to go over these services one by one,
Sure.
but actually, why don't we start with you, Kate, and talk about how Planned Parenthood offers really basic education to the community. You work with students on all levels. Why don't you talk a little bit about, you go into the schools, why don't you talk a little bit about what you do in the schools?
I do education in the schools, and I take requests from teachers, and I can present any number of topics, anything from reproductive anatomy, healthy relationships, skills for choosing abstinence, sexually transmitted infections, HIV and AIDS, birth control methods. With some schools we do a whole range of presentations. With some they just call us in for 1 or 2 presentations. But it's a really wonderful opportunity to be able to interact and teach kids such important information.
And do you normally do this through health classes? Is it specific topics that usually it's
Yes.
health teachers who call you in? And
Health or life skills teachers. We've gotten calls from principals before too, or school nurses where issues come up at the school and they want us to do a presentation to address that. We've done presentations on sexual assaults, sexual coercion, things like that when an issue has come up at the school too.
so that's really interesting. You don't
Yeah.
just do the, you think of it as sex education as being very basic, that you do the very basics of, what reproduction is all about and how reproduction works. But you're talking about even very specific, something that might come up in a specific school, that you're very
Absolutely.
prepared to go in and talk about it.
Yes.
And tell me how you pitch it differently to kids of different ages. How early does sex education start, say?
The youngest group I've worked with are 7th graders. And I have to say, I know I shouldn't have favorites, but I think middle schoolers are really wonderful to work with, and they're very engaged and they're very interested in learning. And you just really have to, obviously talk differently to middle schoolers than what you would do to high schoolers, than you do to college age students, than you do to adults. And you just have to really gauge it towards their maturity level, what they're interested in, the questions that they ask. And a lot of that I kind of go back and forth with them. What are they interested in? I go back and forth with them with their questions. And,
I would
and
also
base it
think
from there.
that
Yeah.
sex education changes over time too, because for
Absolutely.
example, you didn't really, you never heard about safe sex, for example. When
Right.
I was learning about sex as
Right.
I think a 5th grader, we first learned about menstruation, for example, where they divided up the boys and the girls,
Yes.
and they were talking about that. And now I would think that you want to start out very early to talk to students. And how do you approach that kind of topic? Talking about safe sex, do you do that in the 7th grade, or do you wait till they're in high school?
We do that with 7th graders, and it's in the 7th grade and 8th grade classes that I've talked with. It's in their health curriculum. Sexually transmitted infections is in their health curriculum, so it's really a supplement to what they're already getting in a lot of ways. And we do talk about safer sex practices, especially if we talk about contraceptive methods, and we talk about what's going to protect you against pregnancy, what protects you against sexually transmitted infections.
So let's let you jump in here now, Lisa. We're talking here about, basic, as you put it, basic sexual health. And let's talk specifically, go over some of the services
Okay.
that Planned Parenthood provides nationwide. And let's start with sexually transmitted infections, because that's something that when people think about reproductive health, normally they think about preventing pregnancy.
Right.
And let's talk a little bit about how important it is to talk about sexually transmitted infections, because that rate is actually quite high in the U.S. We kind of deal with infectious diseases very well, but sexually transmitted infectious diseases, we have not been able to subdue very much, have we?
No. Gonorrhea and chlamydia rates especially, and primarily women and men between 15 and 24. That's where the rates are really increased. I'm guessing it's just they're starting out having sex, not sure how to protect themselves, and those are the rates that we're really seeing.
And you mentioned chlamydia. I think people are very familiar with gonorrhea, but chlamydia is probably, I believe it's the most prevalent sexually transmitted infection.
Yes.
What is chlamydia?
Chlamydia is an infection that is transmitted sexually. You can't get it from sitting on a chair or anything like that. And it's an infection that can be either in the penis or in the female reproductive organs.
Or in the vaginal canal.
Right.
Yeah.
And it can often no symptoms. Kate can help me out with this as well. But women will always say, well, I could tell if he has it, or I can tell if I have it, and you can't. Very few women know that they have a sexually transmitted infection.
And we should talk about when this is diagnosed, both partners must be treated.
Definitely.
You can't just treat one partner, otherwise you're going to keep back and forth. It's going to go.
Absolutely.
And chlamydia in women is very serious. Talk about the repercussions of untreated chlamydia.
Right, so it's like you said, it's the vaginal canal, but if it's left untreated, it can go into the uterus, it can go into the fallopian tubes, and cause scarring of the different reproductive organs, which can lead to infertility later on.
Right.
It's not, oh, I've got chlamydia. No, you need to get it treated. It's easy to treat, but it must be treated.
And it's treated by antibiotics, I believe.
Is.
Absolutely.
But once the fallopian tubes are scarred, you can become infertile, because then the fallopian tubes are blocked, and that is very difficult to unscar. You can't unscar a scar. So this is something that should be treated.
Definitely.
Now let's talk about, are there symptoms, or can you go into a doctor when you go in for a checkup and say, would you please test me to make sure I don't have chlamydia?
I would recommend at every annual exam, go ahead and get tested. We're lucky to be part of the infertility prevention project through Ohio Department of Health, where the cost is minimal or no cost. Often it's no cost, you just have to pay a handling fee. So you go in, talk to your doctor, it's a swab in the vagina, he or she's already doing your pap smear. Go ahead and get swabbed for gonorrhea and chlamydia, it's just one other swab, and you're tested.
And what about men? Can men be tested as easily?
Men can be tested. It's a little bit different. It's still a swab in the penis, but we're actually looking at urine gonorrhea and chlamydia tests for both men and women. So it'd be, you're doing your own test, you just urinate in a cup and it's sent to a lab.
So when you do these tests, are you looking for multiple infections, not just chlamydia? Are you doing a whole range?
Great question. Often women think they come in for their annual exam, they're doing my pap, they're doing everything. No, each specimen test is keyed into.
So it's specific to
it.
It
is.
to
So you have to ask for the test that you want to have done.
And we should say a PAP is testing for cervical cancer.
Testing for changes in abnormals in the cells.
Okay.
Yes.
Thank you for clarifying
because
that.
It's not going to tell you whether you have cancer or not. There's other diagnostic tests that can go further with that. But that's a screening, and women should have that done every year.